tell me what happened in our first visit.
Um,
How has the body been doing?
it's been better, really. I feel a lot of relief.
Okay.
Yeah.
So you came because you were having issues with exercise and lifting.
Yes.
We went over your x-rays. You understand everything that's going on.
Mm-hmm.
We understand the imbalance that we got to deal with as well.
Yes.
Okay. And we gave you an adjustment about 2 weeks ago.
Tomorrow, yes.
Okay. How was the soreness after that?
The next day, it was a little bit tense.
Okay.
But after that, I did feel a relief because I always had like this lower back pain throughout the whole day. And the day after that, I just felt, I felt the pain there, but it wasn't that consistent, like that grueling pain that you get at.
So the intensity was less?
Yes.
The frequency during the day was less?
Yes.
And how about the duration of when it would come up? Would it last the same amount of time or a little bit less?
It would be a little bit less.
Okay. And what's the biggest change for you?
It would be the pain in the back because I do a lot of like crouching, a lot of lifting things up for
Crouching
the floor.
tiger, hidden dragon stuff? Okay.
Yeah, so
Work related?
yes.
Okay. So work was a little bit easier?
Yes.
Okay. All right. Let's take a look and see. Come over here. Let's watch you walk first. One of the things we have to figure out with you is your heel lift we talked about, right?
Yes, my right leg.
Correct. So we have 12 millimeters. We need to bring it up 5. We said with the adjustment itself probably won't do it. If we can get the sacrum up, great. If not, we're going to put a lift in, okay? Let's walk it out, please. Back and forth several times. Good. And we have something to compare it to. Keep walking, please. So you notice how he swings. I'm just recapping also for you. You notice how he swings that right leg. It goes like this. So it's externally rotated and it swings out from right to left. Walk one more time and we'll get started. Okay, have a seat, please. All right, starting at the base of the neck. And we are getting that C5-6 area. Now, we had one visit a couple weeks back, yeah?
Mm-hmm.
And for whatever reason, we had to take a little time off, but we're back on track now. And we'll see how it goes over the next 1 or 2 visits with you, okay?
Yes.
You got it. Upper back is good. Nice. Sit up a little straighter. Now, this is how Daniel's supposed to be. This is how he's sitting. This is how you need to be. This is normal posture. Daniel?
Yes.
That's normal, okay? How does that feel to sit like that right now?
Pain-wise or?
Pain-wise and comfort-wise.
Well, pain, it hurts a little bit, lower back.
Down here,
Comfort,
yes?
Yeah.
Okay.
Comfort, it's odd since I don't sit like that often, or?
Correct. Now, I want you to go to what's normal for you right now. What's comfortable. So he's got that C-shaped sitting position, which is very typical with a lot of people today. Why? Computers, right? Slouching in the couch. Now, what's interesting today, Daniel, I'm a little surprised what I'm finding. Your low back is actually clear down low today. It's here, senor. Right there. That's around L3. Sit up straight, L2. That's the one that's going to get him upright. Now, if I do my job correctly, it's going to hurt to slouch. It's a good thing. And I want you to see, Leslie, I want you to see this. So go back to your normal or comfortable position. So he's rounding. This curve is supposed to go forward. So what do you think these ligaments are all doing? These ligaments are all adapting and shortening in this position. So as soon as we try to do this, it don't feel so good because the memory wants to bring it back. Does that make sense, Daniel?
Yes.
Okay, let's check your pelvis, please. Feet together. Open and close the knees. Open and close. Good. Left side only. Right side only. So when he does the right, the left is fine. When he does the left side only, there's a whole shift of this side. It's not just the pelvis. This whole thing is stuck right there. You feel that, sir?
Yes.
Yeah. Sit back for me, please. Scoot back for me, please. And sit up straight. Número 5. Come back towards me. S1. S2. It's tender, yes?
Yes.
Okay. There's no pressure there today. I know it's tender. We'll test it after we do this one, and we'll see what happens. And the whole idea is we're not chasing it, right? We're not chasing the symptom. We have to find it, accept it where we find it, fix it, leave it alone. In this case, 5, 4, 3, come back towards me. Pain.
A little bit.
2.
Yes.
2 is more, yes?
Yes.
Yeah. 2 on the right. Head down, please. Right there. Yes?
Yes.
That's L2. So today we're going to do L2. I'll check the hip and sacrum after that. Sit back for me, please. Do you have any questions for me?
Not at the moment.
Okay. Right ear down, left ear down. Right there. Okay. Let me go to the x-ray. And if you want to come over here, I want to show something to what's the only thing. So we know there's a short leg here, measured difference of 13. We started on the sacrum. We know it is binding here on the sacrum bottom, but the pressure I'm getting is this third lumbar. So we're going to set the third lumbar as a PRS, and I'm hoping getting that power is going to change the mechanics of that right side today. Okay? All right. Center on the chair for me, please. Scoot to the right a little bit. Left hand up. You ready?
Yes, sir.
Showtime. Oh. Nice and easy there. C6. Now we're getting right underneath it. C6. Now he's pretty flexible. Okay? Relax the best you can. He's pretty flexible. And we just need to get that lifted up. Left ear down. There you go. Nice. Walk it off once and then we'll go face down. Tranquilo.
Yes.
Bueno. Look. Número 3. Hold on. Bueno.
Yes.
Come up slowly. Let's go face down over here, please. Take it. You okay?
Yes.
Talk to me, Daniel. What's up? You okay?
Okay.
Awesome. Número 3. 5, 4, 3. Let's do it quick. L3. Good. Lift your chin up. Shoulders down. Poquito. Gotcha. You okay? 4, 3, 2. Fantastico. Come on. Let's walk it off, please. All right. Walk it off 2 times. Little spicy.
Little bit.
Have a seat. Let's see how the sitting is now. Sit up straight. Is that any different in how that feels when you sit? Is that more comfortable or is that
Just
hurt?
a little bit more comfortable.
A little bit.
Yeah.
Okay. Cool. You doing your walks every day?
Yes.
Beautiful. L3 is clear. Mira, sacrum is clear. Come back slowly towards me. Keep going. Straight. 5. All the way back, all the way back. 4. All the way back. 3. Diferente.
Yes.
Diferente. Is that different in the tailbone now?
Yes.
So what you can see as we're doing this, watch here, you can see there's getting a little more extension around that area. Right here I want you to see. It's bulging a tiny bit here, but we're getting that curve. So today, I want you to start flossing for your spine. There's a video I have on my channel called Flossing for Your Spine. They're basic back extension exercises. The other thing is getting a yoga ball and just sitting on it and bouncing 5-10 minutes a day. You have a yoga ball at home?
I believe not.
Okay. Well, why don't we like you to get one, please?
Yes.
Get a red or a blue for you. Okay? Muy bueno. Nice. Feet together. Open and close the knees. Open and close. Right side only. Left side. That completely changed the mechanics of the right SI joint. You do feel that, right?
Yes.
There's not a big shift now. Again, guys, we're not chasing it. The whole point I'm making is if you're chasing the pain, you'll open a can of worms. And if you chase the pain of your patient or client, you may get it, but you may open up that can of worms. Go on your back, sir. The thing that's going to help bring that spine curve better is going to be that IN ilium, the internal component. He has a PIIN where the IN is major. IN major is similar to actually an AS, which causes a slight raising and a straightening of the spine. We bring that out. It will do what? It'll help accentuate the curve a little bit for you. Okay? It's supposed to feel uncomfortable right now. If it's feeling comfortable, then it's not right. In your case, at the moment. Raise your right leg. Raise your left leg. AS talus, medial tilt. There you go. Let's walk it off one more time, please. And I have one more piece of homework for you.
Yes.
Right over here. I want you to stand on one leg. And this is balance exercises. We're doing standing on one leg, 2 minutes, eyes open. Easy enough, but be consistent. Yeah? Both sides. Once we can do 2 minutes, eyes open each leg, 2 minutes, eyes closed. You're working on the balance. You're working on proprioception of the ankles and the base of the neck, and you're working on balance. I don't want to add any other variables today. All right. Okay, squeeze the hand. Let's check the hand. Squeeze. Radial head. Squeeze. Squeeze. You continue as you're doing, please. No extra stuff, no extra weights or anything, just walking on your work. If you're lifting anything heavy, you can use a weight belt, but not using it to support yourself without. Breathe in. There you go. Gotcha. Squeeze. We're missing. Okay. That was a little spicy. Yeah, go like this 5 times. Squeeze. Solid.
Yes, yeah.
Bueno?
Yep.
Bueno? Poquito. Gotcha. Squeeze. Squeeze. You're all set for today. Questions?
No.
I'll see you next week.
Sounds good.
Okay, sir?